We're here at the TOBI, the Orthobiologic Institute Symposium, the 10th event right here at McCormick Place in Chicago, and we're interviewing people talking about the most important issues of cell therapy. And I have one of the best experts on that right now. I have Don Buford. He's from Dallas. He's at the Dallas PRP and Stem Cell Institute. And we've known each other for a while. He's really humble, but this guy is awesome with the ultrasound. And not only that, he's not a bad baseball player either.
You're too kind. But we're not going to talk baseball today.
We're not. So the whole point of this is to try to get across what are the most important issues in this growing area of science. And I know you've been involved with a lot of things, especially on the ethics part of it, which high five to that. I think that's good. So what would you think is the most important issue right now in cell therapy?
Well, setting aside the ethics piece, which is obviously important, I think the clinical issue that is most important for us is developing dosing criteria for a specific orthopedic pathology. So I would love to get to a point one day where we say this person has mid-grade knee arthritis, he needs 30,000 stem cells at least on a same-day procedure, and then be able to quantify that on the same day, which is another issue that we have right now, being able to quantify our dose on the same day. But being able to do those two things and have the patient walk out knowing that we did something as easy as taking 2 Tylenol out of a bottle.
He is a smart guy. And what's preventing us from doing that right now? Why can't we do that right now?
Well, in a certain sense, regulatory prevents us a little bit because it limits the orthobiologics and it limits the cellular therapy that we can do in the United States at least. We might be able to get more data faster if we had more clinicians using more cellular therapy. Right now, we're trying to push registry data and data collection, which is, at this point, one of the biggest rate-limiting steps. You just don't have enough data points. Part of the issue is, as you know, it's hard to quantify. We can't get a CFU or a cell count on the day of the procedure, and for regular clinicians like us in the office, we don't have a PhD level lab attached to our office to be able to do that. So making that cost effective. Some of our colleagues at this meeting are setting up those labs where they're basically a for-hire PhD level biology lab, and that's the kind of thing that will help.
Yeah, to collect all that data and put that all together so we can use this data to better this whole process and standardize this process, which I know you're on, and you go ahead and you measure that PRP before and after. That's awesome. So that you can go ahead and tell your patients that they actually got a platelet rich, not a platelet neutral or a platelet negative therapy. So, so Dr. Buford's key points are that we need to be standardized. We need to go ahead and be able to tell patients exactly what they got and how much they got so that we can quantify and further this whole process here to refine it. Because it's always a refining process, isn't it? Just like in baseball, you're always trying to make it better.
We're at a stage where patients relate to a story when I say, it's like me giving you a bottle of Tylenol and saying, we're going to give you 5, but you may only need 2. Okay, you might not need 10, but we just want to know and continue to hone that data and so we can give them the best treatment.
And when we went to the FDA, one of their biggest issues, like when we would say we want to do the study, they were like, how much are you going to give them?
Yeah.
And it was really hard to say, well, we're going to draw 60 cc's and we're just hoping that it's going to be 30,000 CFUs in there. But now we'll be able to do that in the future. That will happen. From the 10th annual Biologic Institute seminar, we're here with Dr. Buford from Dallas. So if you're in Dallas and you're looking for a great guy to do your PRP or bone marrow, this is the guy to do it.
Thank you.
Thank you.
Thanks. I appreciate it.
Yeah.